But as time went on, I realized that although I was winning battles every day, we were losing the war against coronary disease. Why should we just treat it at its end stage? Why couldn't we move upstream a little bit? And why couldn't we maybe prevent this? So I started looking and thinking and studying, and I came to the conclusion that heart disease was a nutritional disorder. I had been treating it as a mechanical solution. Plugged up pipes. I was a plumber, a glorified plumber. Maybe not glorified. But at any rate, I decided I had to do something different. I started making noise at the hospital where I was chief of staff. Well, they didn't want to hear about it. So I closed my surgical practice in 2003 and opened a weight loss clinic. I figured if I could get people to lose weight, I could help them eliminate their risks of coronary disease or reduce their risk of coronary disease. So for a year, I did that. I was absolutely thrilled that weight loss was almost a side effect. We were reducing diabetic medications, eliminating insulin, taking them off their antihypertensives, stopping their lipid-lowering medicines. I saved one young woman $1,000 a month on medications alone. So at the end of that year, I said, this is working. I'm right. I need to spread the word a little wider. I need to get some more people understanding that they really can cure and prevent and reduce heart disease. So I wrote a book. I wrote that article that Doug talked about that's been shared on Facebook probably more than 1 million times now. I did an online course about coronary disease. I was on Fox News a couple of times as a coronary disease expert. So I was making a lot of noise. And so if I was right that we could cure and prevent heart disease, I was a huge threat to the revenue stream of the hospitals, and I was a huge threat to the credibility of mainstream medicine, which I always considered myself part of. So some 4 years after I retired completely from practicing, the Arizona Medical Board reviewed some cases that went back as far as 10 years. Now, those of you who are doctors know that if you review a case with a complication, you can always, 100% of the time, you can find fault somewhere. So I'll admit that maybe I made some mistakes in dealing with them, but they seemed very, very intent on hurting me. And so after they reviewed these cases, they revoked my medical license. So in some ways, I didn't care. I wasn't using it. If I'm not driving a car, I don't need a driver's license. In other ways, it hurt me very deeply. Here I'd been faithful member of the community for all these years, serving, and then they put a blemish on an otherwise blemished 25 years career. Now, is it a blemish? Or is it a badge of honor for having the courage to speak out? Now, I'm no Tim Noakes, but I know how he feels and what he's gone through.
Since Doug had said that this is Q&A time and not for statements,
okay.
In light of that, you did ask a rhetorical question early in your presentation about whether or not it was a badge of honor. And I think I speak for many people here that indeed, sir, it was a badge of honor, that you were willing to risk your license to further the discovery of the science.
Thank you.